Hi, everybody. It's Life and Vibe, otherwise known as Ray. And today, as a registered nurse and somebody who's training into the nurse practitioner field, but I do psychiatric mental health, which obviously touches on Tim. I don't treat or diagnose though, but I did want to check in and follow up post glaucoma surgery. I wanted to go over some of the basics of good operative care, post-operative care, and see if Tim is following the instructions of his doctor or his surgeon, whichever way you want to refer to them. And before we get started, though, let me put up my fair use, Tim, first, because Tim, you've been wild lately. So obviously, that's my fair use statement, and I'm going to use this as transformative content and make my opinions, and these are my opinions, and these are all alleged, and it's smattered with obviously my expertise as a registered nurse, but Tim, I understand, has been at it again. Before we get into the video, if you have an opportunity and could go to Buckeye Gordon's channel and show Buckeye some support. And Buckeye, if you want to send me an email, my email is in the About section, and I can help you walk through this since Tim has decided that he's going to strike his channel. And so Tim obviously has downtime, post-operative surgery, and he usually, when he seems like he's getting like he doesn't feel good, he gets upset with any reaction, parody, whatever type of channel, and he then strikes at them. And the good news is, Tim, if you continue with this, YouTube is not going to be very happy with you. You cannot continue to strike with no warrant to channels. This is not very good YouTube courtesy. It's not good etiquette. It's really probably against terms of service too. So I would be cautious if you want to continue with your cash cow of YouTube and the captain of the sad fish that you're doing at the moment. Because I think coming out, and I'm saying this as somebody who's a healthcare professional, and showing up to your audience this way and bending over and starting cameras and stuff is actually probably counterindicative of your post-operative results. And I think you could have either pre-recorded some crushing it for Christ and just pop them out and nobody probably would have been the wiser, or done something else, or just taken a day or two off. But I think you actually are addicted to the attention that you receive being on YouTube. But anyway, we are going to go over how he should be looking at after his eye at the very end of this video. And I'm going to bring up a very easy to find National Institutes of Health article that if Tim had done a quick Google search, he could have had the answers for his pain, his eye pain. But Tim seems to think that every type of pain warrants having some type of narcotic prescription medication to relieve the pain. And that's not really how we try to prescribe medicine, because we've seen the effects of using these medications, which many physicians in the past were misled to believe were non-addictive in the forms that they were being dispensed, which made no sense, but that's how it was sold, and somehow people believed it. But that's not true, and we understand that now. So there is a lot of caution when we prescribe to people. Now, Tim has admitted to the fact that he has used substances in the past, such as alcohol and marijuana, smoking things. And so that could be counterindicative of wanting to prescribe somebody with controlled substances through a pharmacy. And so that would be something you would want to weigh out when you're prescribing. Anyway, I've talked too long, and I know here people are here to watch my Tim reaction, but I did want to mention that Tim has been striking channels again, so he's not in a happy place at the moment. And either he's not getting enough coffee donations, the views for all of his sad fishing surgical stuff are probably down, but I'm going to put him at 1.5. I'll try to put chapters so that you can go straight to the reaction, guys, and get over mine if you want to hear me just reacting to Tim. All right, Tim, take it away.
Hey, good morning, everybody. Oh, sorry about that. Well, retake. Hey, good morning, everybody. Sarasota, Tio.
I'm going to say the first thing, Tim, you were bending over quite a lot to get this camera started, and that's not something that you should be really doing. So, I mean, they don't. So, just, I mean, caution with that. I mean, is it really that you have to be out? I mean, I think it's the attention. I really do. All right, Tim, keep going. I'm not going to stop you, but just anyway. All right.
Coming to you from inside my good friend's house. It's helping me out. And let me tell you, without the help, I would be in a world of hurt. I just couldn't talk yesterday because let me see if I can go back to the beginning and tell you the experience I have had with this eye operation. Let me put this mic on. I'm still in pain, but nowhere near. Should have been more prepared. Hang on. I want to thank my good friend Jay.
Yes, you probably should be, since you're a professional YouTuber, Tim.
JJ, for making this shirt for me. I'm trying to be in uniform for you guys. I cannot shower. Obviously, I cannot get my face wet or anything. I'm returning to the doctor this morning at 9 to have this removed, I believe, and the pressure checked. So the first eye operation I got, I guess it was a year ago.
You're not supposed to be touching around the eye, and he needs to, I'm glad there's a protection there, but he's somebody who loves to touch around his eye, and yes, he can't shower, so at least he knows one of his instructions, and obviously they do have the follow-up. So all right, keep going, Tim.
Underwent full anesthesia, and I woke up with no pain. I didn't feel anything. All I had was this bloody red eye for a long time. I really had no discomfort whatsoever, and I don't remember what it was called, but it was something where they stick a little tiny microscopic straw in your eye, and it helps keep the fluid going around the eye that keeps the pressure of your eye low. So
sounds like some type of cannula. That's usually an opening tubey thing. You could have a variety of cannulas. So sounds like they put a cannula in your eye or a drain. One of the two.
Apparently, this new doctor told me that that's something that he would do only on someone very old that wouldn't scar over. But because I'm younger and healthier, my eye scarred over that procedure and it didn't work. So that's why the doctor had me pressing my eye and all these things. It ended up just not working. But even though the operation failed, I never experienced any kind of discomfort or anything except, like I said, for the very blood red eye. It was very, very red for a while. So moving forward, I move over here to the.
Well, that is a sign that the surgery potentially did not go well. And we'll look at this article at the very end. But from what I read, that's one of the signs that that's a problem and should have been followed up very quickly, like 6 weeks after. So I don't know if you left it. Maybe you shouldn't have been traveling around and have just been dealing with the eye and had been following up with that and not allowing so much time while you went off and did a bunch of stuff. Not from what I was reading. So just, keep going, Tim.
The GOA, the Gulf of America. And I transfer my Medicare insurance. I get a PPO, and here I go. I roll into a new ophthalmologist.
That's, no. Well, I'm glad you're going to a new ophthalmologist. Tim, you're wild. I'm just going to say that. You're wild. You're being wild.
Need any kind of referral?
Sorry, guys. I forgot to make Tim bigger than me. Sorry, let me try to change my perspective here. I forget sometimes. All right, keep going, Tim. Let me make Tim closer up. He seems very far away.
With my new plan, my disadvantage plan from the primary, I just roll in and just pick up what I want. They said, yeah, we take your plan. And it's a big organization. And I get this new doctor. And I like the way he talks. He's a nice.
I've heard Dr. Ed Weir try to advise people to not having those advantage plans. I think he was trying to. Personally, I would not advise a patient to take those plans. They seem good on the outset, but as you begin to age, then I think that's not such a good benefit. So I caution that you make sure you really understand, because some of the things they say they do, it's not actually true. So just make sure that you really understand everything. And if you're somebody who really likes to travel, they may not be the one types of, you may not want that type of plan, because they do put you to, a certain set of providers. And then if you go out of state and something happens, then the cost could be quite expensive. And I have worked in healthcare and have had patients who are older and have had Medicare, obviously, and they've had things happen out of state. Maybe they're visiting children, maybe they're on holiday, because I live in a resort area, and they probably aren't nervous about those costs of those medical bills, because they're not going to get those out-of-pocket charges with a Medicare plan. And I think there's supplementals they add to that, obviously, too. But as I was saying, you just have to, if you're somebody, especially like Tim, and traveling a lot, that may have not been his best plan. That's why we say, talk to somebody who knows more about it than either Tim, and I may know more than Tim, just because I've worked in healthcare and I've had to deal with insurances and health insurances for years. So I have more experience dealing with these products than Tim, who quite openly said in a Social Security video recently that he never ever paid for health insurance when he was younger, because it was a waste of money.
Young guy and everything. And he said, yeah, your pressure is high. And I wouldn't have recommended that procedure. I would recommend a tube shunt. And I said, well, you guys are both ophthalmologists. Why does one? He says, can't explain it. Different doctors, have their own thing. Well, we know that to be true, right? The third leading cause of death, going to a doctor. So when he recommended that, and he put me on additional.
I would want to put a recommendation. That's what we put on Tim's epitaph when he passes at 73.
Eye drops. And now I'm taking more drops than ever before. 4 different bottles, 4 times in the evening, and in the morning I only do a couple. And it's just really annoying. And he recommended the surgery. Oh, you know what?
Hearing annoying and you having to follow up, because I read a thing or two about the drops that are to ensure that you have a good recovery from this surgery, and you call it annoying, makes me think you're quite juvenile, in my opinion. That's a very juvenile thing to be said. I think just, yes, it's work. But I think that it's just the word annoying. It's something about that word. It did not sit well with me, Tim. Anyway, continue.
I could use the best cup of coffee I've ever had in my life. All I got to do is pour it. It's ready. That's one thing I can have. Let me get that. I had a long night, so I'm a little lethargic, but I think once I get.
Can you stop acting like you're the king of the castle here? It's all sympathy on Tim, and Tim seems to not understand that there are a myriad. It's like we're in the gray, like the gray tsunami. I hate to say it like that, but there is like a very large generational cohort of baby boomers that are now turning 65, I believe. And so, or 60, I think 60 maybe, because I think they're maybe 5 years older than I am, and me as a Gen Xer. And so that seems right. So it's like the last of the baby boomers are turning 60. And then you're going to get your Gen Xers, which is a very small population of generational population, a very small cohort. And so there's a lot of these folks at the moment. And so, yeah, it's interesting because there's a lot of people then experiencing medical things happening to them because of aging. And so, Tim, I would hate to burst your bubble here, sweetheart, but you're not unique. And that's something that's unique. And he's it's all of it. I always question people when they come out in sad fish like this. It's that attention that's needed. A little bit histrionic, Tim.
Get this coffee in me. Excuse me 1 second.
You know what I mean? Walks off.
Oh, yes. Let's talk about the most important thing in the world. Tim. That's the best cup of coffee.
No.
Oh, I got
No,
that.
Tim,
I got that.
you really think you are the most important thing in the world. Let's be honest.
High House brew this morning, and it's got a little McDonald's in it. That's right. This is a triple mix, and somebody out there named it. I forgot. It was called the Mac House or something like that. Got my heavy whipping cream. It's definitely slurpable. Got good temperature on it. I don't have the paper cup, but there's something about a ceramic cup, good old diner cup. It's not the color. It's not the shape of the diner.
Oh my goodness. I guess it feels like if you're lonely and you really just really enjoy Tim's mundane content, then if you're sipping your cup of coffee, I guess you're sipping a cup of coffee with Tim too, while this guy sits there with an eye patch. I just feel it's his way of trying to get some potential financial gain, because everything with Tim seems to lack a sense of true genuineness to it. There's a dishonesty in my mind, in my opinion.
Cup. But I'm gonna tell you something. That's the best cup of coffee I've ever had in my life, especially since I didn't have any yesterday till after the surgery. That is good coffee, folks. There's nothing better. I'm a happy man right now. You guys are witnessing it, my first cup. So back to the story. It's a good story. He recommended the tube shunt, and this was a couple of months ago before I went out to Las Vegas, or I would say Las Vegas, but it was Laughlin. And it wasn't really Laughlin, it was Bullhead City, out west. I did go to Vegas, though, on the first trip. Anyway. Oh, I need more coffee. It's truly delicious. So let me show you guys this one thing.
Believe it or not, I haven't sped up to 1.5. Oh, this is probably not advised. We'll go into that in a minute. Hurry up, Tim.
I'll get back to the story in a minute. This is also another hat
like that
JJ made for me.
That's small.
But
no wonder
the tan hat I have, it says Sarasota Tim, huge, with a little YouTube icon on the side.
Him leaning over and doing all this stuff is part of the reason why his eye surgeries probably are not successful. Does not follow probably his doctor's instructions. Apart from the drug seeking. Drugs as a medication seeking. Okay, YouTube. Don't demonetize me for that. I'm a medical professional.
If I tell you, you're going to notice it. You can always notice when I wear the hat. But the Sarasota Tim kind of goes down a little bit. So we added the YouTube icon there, and it looks all right. I like it. I definitely like it a lot. So thank JJ for the two shirts and the two hats he made me. Now back to the story. Oh, my eye's falling off. Look. Look at that. Here's looking at you. You guys are supposed to keep an eye out for me. Oh gosh, this story's good. Prepared.
Oh, sorry. I didn't mean to hit
Needed a ride.
Hold on.
I needed help.
Hold on. I was supposed to be at 7:41.
Can I postpone it?
Hold on.
He said, "Yeah, you can keep."
Sorry, I didn't mean to switch around like that. I'm sorry. I had to stop him because he's playing with the eye patch and leaning over. I'm just astounded at this lack of awareness that he just came out of a surgery. He's like, let me go back, because I think we were right there. That's where we are. Right when he leaned over, and let me see, right here. Can I get the action? Let me get back. Hold on, let me get him.
I like it a lot. So
hold on.
Thank JJ for the two shirts and the two hats he made. Now back to the.
This is probably not advised. Not advised at all. And he's done it twice now. It's because your pressure. Just relax, Tim. Just sit in an armchair, recliner, put your feet up. Get the camera off.
The story. Oh, my eye's falling off. Look.
And then
look.
He can't stop touching. Don't touch the eye. Leave the eye. Oh. Sorry, as a nurse, this is frustrating to see, because it's going to mean all of these things that he's doing. Then he'll go to the doctor. Oh, no, I didn't do any of that. And we're watching him clearly on video do things that are probably going to be risk factors to not having a particularly good recovery. Tim, you need to it's Tim. We can't stop him.
Look at that. He's looking at you.
Always a jokester.
You guys are supposed to keep an eye out for me. Oh gosh. This story's good.
That's a bad joke.
Never get back to it. So he says, I recommend the tube shine. Yeah, we know that part. I go out, but I said, but I'm going out west. I'm a YouTuber. And I don't want to go through what I went through a year ago of waiting for the eye to heal, and then you're going to want me to come back in every few days, every week or two to check the pressure and
Right.
all these follow-up visits.
Right.
Can I postpone it?
Weren't you trying to preserve your eyesight, Tim? I guess your need to get out to Laughlin, Bullhead City, Las Vegas, whatever place you deemed you were at, was more important than you actually taking care of this. That's astounding to me. But it's not, knowing how negligent you seem to be. This is why
He says, yeah, you can keep taking the drops, and if the pressure stays down while you're gone, you don't have your eye explode. Take a chance. And maybe never need it if the drops work. He added some more drops. And without knowing, because I went out west and didn't go to a doctor to check it, I felt fine. And I took my drops religiously like I was supposed to. And then when I came back, I tell you guys all the time, my eyes all.
After you said it was annoying, I'm hoping you could get whatever prescriptions when you were out of state, because mostly those bottles last like, what, I don't know, 30 days? Something. They have certain amounts of time that you can have them open. I think you get them refilled. They don't last but a certain amount of time, especially if you're doing them as prescribed. How do I know? Because I've put a lot of those drops into patients' eyes that are senior patients, older patients, or older adults.
Always so red, I look like a stoner. And I called him up. I said, there's something wrong. I think there's maybe my pressure's high. Maybe these drops are not working with me, because my eye's really red. It's kind of embarrassing. So I go in, and the first thing he tells me, that's because the drops are working. I said, you mean I gotta have red eyes, rest of my life? Come on. So we started discussing the tube shot surgery again a few weeks ago, and I agreed to go ahead and move forward with it.
So what I just heard was Tim trying to absolve himself of any responsibility if this one doesn't go well, because he did everything he was supposed to between the last eye surgery up until he got this current eye surgery, even though he kind of made some implications that he was a little irritated with having to actually keep following up and get his eye checked and have them looking at his eye and trying to make sure that everything was okay with it. Because I'm sure Tim would go in there, oh, my eyes are red, so they're obviously going to follow up with it. And obviously they look at things like the pressure and they can see there's like objective information. It's not just subjective.
The time came, and
that means from Tim, not the red eye. Red eye is obviously objective because you can clearly see it. Tim's explanations or what he says is always going to be subjective just because it's coming verbally from the patient.
Another thing I need to go in this morning. Tape's coming off. So the time came, and I had to be there at 7 o'clock in the morning. I needed a ride. I needed help. And by the grace of God, through your prayers and a wonderful person to help me out, I could have never have dealt with this the last 24 hours by myself. Never.
I call that prayer thing from you, Tim, religious manipulation. And the fact that you allow people to call you Pastor Tim, I saw in your comment section on your most recent Crushing It for Christ, is just wild, considering you were an adulterer, or maybe, I don't know, maybe you were not married at the time, but your partner in crime was, when you had relationships that, whether emotional or physical, were probably inappropriate for a woman who was married. So I just felt, anyway, it's just a past attempt. And then he doesn't correct people. Like, this man went to like some type of theological college.
Ever. And so I get the surgery done. I go in, and get this. The anesthesiologist comes in. He's a gregarious gentleman about my age. And we started talking. I told him I was a YouTuber. I think he's going to check out the channel. And I'm going to be under a slight sedation.
The anesthesiologist is going to check out your channel, Tim. Oh, my goodness, Tim.
I'm not going to be under. Remember the first one? Completely out. Next thing I know, I woke up. It's over. I felt nothing. Because I'm awake, I'm not talking about where you're in twilight, where you can't even talk. You're just sort of like aware. I'm totally talking to everyone. and they're talking, and they got music playing, and they're talking about the Emmys, and everything's going on. And I'm just sitting there, I'm like, remember me? And so I just started talking with them, and we even talked about guns. I mean, I was completely, but you know what he did? First thing he did, he says, I'm gonna have to numb your eye by, I don't know, cutting off this nerve or shutting this nerve down. So he literally, I guess he gave me a little extra juice because I did feel a little loopy or sort of sleepy, like I was ready to go to the best sleep I've had in my life. So next thing you know, I feel him pressing. He's shooting a needle in my eye to numb it so that he can do the procedure. And because I'm awake, I hear him ask the girl, the nurse, what time do we start? How long has it been? And she said something like 8:23, and it's been about 30 minutes. And I'm talking to him. I said, well, how many of these you got to do today? He only does surgeries on Monday. He said 21. I said, 21? He said, well, no, they're not all tube shots and stuff. They're going to be like some cataracts, which take 5 minutes. Oh, my eyes hurt now. I think maybe the caffeine. But 21 procedures he's going to do. He did yesterday. So we're talking. And I'm asking him, I'm saying, now, where is this thing? Is it microscopic? I have a
just try to train your hand away, Tim, from your face, because they advise you not to touch it. Don't touch the eye. You always touch your eye. You need to not touch your eye. And if you are, with clean hands, which you've been touching your coffee cup and touching your microphone, at this point, your hands are probably not clean.
Microscope procedure. Well, it's very small. You don't need a microscope, and he's putting it above my eyelid on the upper part of my left eye. And I don't believe the first one required any cutting or anything. He had to put stitches in my eye. Mm-hmm. And the longest part of this procedure was him suturing my eye. Mm. And I said, that's
why they don't want you touching around the eye, because I read that you must have had this trabeculectomy or whatever it's trabeculectomy. That's what it's called. Oh my goodness, it's one heck of a word. That's what, because it sounds like this, what I'm hearing here because of the sutures. So you need to be gentle with your eye, Tim.
Stitches? He said, yes. I said, well, of course they're going to dissolve, right? I'm going to come in and pull them out of there. Yeah, he said, yes, they'll dissolve. Oh. And so, I don't know, 45 minutes or an hour goes by the time I leave there. And again, I'm wide awake. And the guy that did the anesthesia.
I used to have to remove stitches from people who'd had upper blepharoplasties. So, and they're really tiny and there'll be lots of them. So it's, but that's good that they're dissolvable. Yeah, because it's right there in the eye. Yeah, that seems appropriate.
The anesthesia, he's so good that he literally kind of tapered me off to where pretty much when it was done, I was kind of like fine. I'm sure I still had some in me, but you know what I mean? I wasn't, they take you out in a wheelchair, they do all that. And of course, my good friend was there to pick me up and bring me back and everything. And so grateful for that.
Tim, we know his proverbial rear end you're trying to kiss up to at the moment because she's in the other room. We know it's Miss Tammy. We know Miss Tammy helped you out, and that's okay. Because we know if it was anybody else, their name would have been dropped by now. The secrecy is saying it louder than anything, you channel striker.
They were going to give me a ride. Tim. Well, they want to see me the next day to take this off and check the pressure. They don't give you a ride for the next day. And I didn't want to trouble my friend, but I thought, well, if you don't mind, because the next day I need a ride too. And I thought, well, they're probably saying that because I had anesthesia the day before and they're just trying to cover their butts and don't want me to drive again. I can't drive. I can't see this thing in my eye. I mean, you cannot, I don't know how people.
Why would you have, well, why would you assume that post eye surgery, you would be good to go and drive? That's a little sense of entitlement, Tim, that does not consider other drivers on the road.
People do it with one eye, folks. It would be very, very difficult. Anyway, back to the story. When the surgery is over, he tapered me off, and I felt pretty sober, pretty good. And I had no pain. Well, little did I know, I had more of that juice in me than I thought, because it's a painkiller juice, not just, well, it didn't put me to sleep, so it was probably just painkiller. And I come home. The first thing I wanted to do was get a cup of coffee at McDonald's. So I went straight.
Well, some type of probably local anesthesia, and potentially it probably did have some type of analgesic in it because they're having to stick a cannula in your eye to get that shunt in there. I mean, what do you think, Tim?
At McDonald's, I got a senior coffee and a breakfast sandwich because I had to fast. and there's nothing to do. Can't bathe. Don't go get dirty. They gave me these. I got these right here. I got to wear these for 2 weeks. I had these before. They'll fit better without the patch on today. They got a little thing on the side and everything. And hey, I wonder how that looks on my black.
How many times are you going to lean over in this video, Tim? Are you just post-operative? We're going to go over those. Don't worry.
Yeah, it'll be kind of cool if I don't have that patch on. Nobody will know. Let's see. Just imagine no patch, huh? I'll still want to make videos. So
we can see.
Come home. This is the best part of the story. Not for me though. Look, I got the flapper going. I got to hurry get there at 9 o'clock. The pain medicine started wearing off. You ever had an eyelash in your eye? You ever get something in your eye and you got it? You can't close your eye. You got to get it out immediately. You're dying. How about 10 eyelashes in your eye? Folks, I was told not to bend over. Don't go to the gym for 2 weeks. Don't strain. Don't even make a strenuous bowel movement.
Not to bend over. How many times have you just bent over now, Tim? Because that's bending over. Believe it or not, that's bending over. I just watched you do it multiple times. It's not just touching your toes, Tim. It's every action you just did then. Anyway, keep going, Tim.
Don't push pressure to your head that pops your eye.
What have you
I failed miserably because I did a few things and bent over, and I don't know if it exasperated it or if it's just the medicine was wearing off. But I wanted to check in with you guys yesterday, but there was no way. Literally was worried I would have to go to emergency. Literally like, well.
It makes no sense to me. Why prioritize these videos? What is the addiction to the adulation of your ever shrinking audience, Tim, that you have to compromise the results of your surgery, a second surgery, for your behavior that you cannot seemingly control? You can't stop making the videos. I think if your audience genuinely cared and they would have understood why you weren't checking in. This is compulsive, in my opinion. It's not healthy. And it's a really sort of a relationship with the platform that is, it's unhealthy. It's unhealthy.
If I need to have him help me, if something's wrong, how does he's not gonna go back to that surgical center. It's way on the other side of town. I go to an emergency. They don't know anything about eyes. You know, what's he gonna do? Come in the middle? I said, God, please get me through the night. So I get no pain medicine. He does not.
So because you are not adhering to your post-operative instructions, and I can see it visually with my eyes how you're not, then you would go to an emergency room, which is for like real trauma victims and stuff. I mean, we're talking emergencies. This is something that you had, and the hospital is gonna tell you that they'll triage you, but they'll probably tell you to follow up with your doctor in the morning. That there's nothing much they could do, and take a Tylenol and go home, because that's what you should be taking. But this is the part where Tim gets into the controlled substance seeking behaviors, in my opinion. And this to me is interesting to watch, because this is one of the things that I work with or studying to work with. And I have worked with it, to be honest, in my role as an RN, because I've had to have patients on controlled substances as part of their pain medication regimens, in hospice, end of life. When I worked obviously in oncology, I've dealt with a lot of this medication. And I've also dealt with patients that have these controlled substance seeking behaviors in large city hospitals as well, and have had very interesting conversations. And so I'm very attuned to seeing these as signs and symptoms. And this is what I'm seeing here, because your discharge instructions, Tim, would have clearly said to take an analgesic, such as an NSAID or an acetaminophen product, i.e. Advil or Tylenol. And probably if you have a cardiac condition, your cardiologist probably wouldn't want you taking an NSAID. So they would probably steer you more towards the Tylenol. And Tylenol is actually pretty effective pain medication. The medications I think that you are looking to have prescribed, Tim, are ones that we use with really sick people. We're talking about people dying of horrific cancers. So I would suggest that your eye shunt is not going to warrant a controlled substance, nor will it be prescribed. Especially with your history of alcohol use and other substances, I would definitely, as I said earlier, would say that's a for you. So
warned me that when this wears off, that I'm going to be miserable with the stitches scratching the inside of my eyelid. And the pressure was both. It was something in my eye, like an eyelash or 2 or 10. And it was pressure. I kept rubbing my temple right here like I had a headache, like a blood pressure, or my eye had pressure. It was awful.
They say it feels like sand in your eye, but it'll go away in a few days.
All day, because this happened in the morning, all day long I had to deal with this. And I was instructed this paperwork that they gave me of what to expect. And fortunately, everything I was going through, if I can say fortunately, was warned would happen. And so I felt at ease that it wasn't something went wrong. And said, what they told me? They didn't give me anything. Take some Tylenol. So I didn't think I had any.
Exactly. So you send your friend to get some Tylenol. When I had my surgery and I had a bunch of stuff that needed to happen, my friend who was helping me get back and forth from my surgery and stuff, they went and helped, get all of they had their name to help pick up my prescriptions because I wasn't able to do that because I was too out of it. They picked up all the Vaseline, all the medical supplies that we were told on discharge. And my friend went to get it for me, so that I would now. Admittedly, I had a much more serious procedure. So I was given I was actually given a controlled substance to take care of my pain because my surgery was intense. I had 3 different surgeries and mine was very intense. So and it was more, so yes, in my respect, because of my expected post-surgical pain and those times when that does happen. So it's not always cancer, but it really, when they know the pain is going to be wild, then they will give you those medications. For this type of eye surgery, take a Tylenol. It'll be fine. They're actually pretty effective.
So I borrowed some from somebody. They gave me 4 or 5. And Tylenol 500. My primary got me on this new Tylenol. You can look for it yourself.
Yeah, you don't borrow. What are you going to do? Buy some more and replace them? Pay it forward with some Tylenol? Take the Tylenol. Gosh. See, I mean, you're making out to your subscribers that you're being gypped out because you're not getting it. The instructions quite clearly say from evidence-based articles that you need to be just taking Tylenol.
At the pharmacy, it's Tylenol arthritis. It's $6.50 because I used to take 800 ibuprofen, but the primary warns that if you get older, your liver doesn't process the ibuprofen as well, so you should switch to Tylenol. So I do, and I did, and ibuprofen's always worked good for me to kill pain, but I didn't want to take any. So I take these and then I discover I have my Tylenol. I packed a bag. I have them. I didn't know.
I'm glad he kept off of the ibuprofen. So, and I'm glad he's, for somebody who always says that his doctors are trying to take him out, he actually learned something from one of them.
Until this morning. And I'm a little better. I got to say, I see that it is healing, I suppose, because the pain level is way lower than I had yesterday. But if I knew, and I'm going to tell that guy this morning, if I knew what I would go through, I don't know if I'd do it. I don't know if I'd do it. And I would just take the drops. This is nothing like that first surgery. This was so much pain yesterday. I'm still in pain and I can't do anything. I just can't wait to take this.
Tim, it's a surgery which they require only an analgesic that's a Tylenol. That means in the scale of what we perceive to probably cause pain because of, dealing with the optical nerve, not to say that you're not feeling some discomfort, Tim, I'm sure. But I think your doctor's going to look at you and smile as you tell him.
This patch off. I hope everything's going to be okay when he looks at it. I don't know how he's going to look in my eye and check the pressure. They get that scope up real close to you. I don't know how he's going to hold my eye open. It's another thing. When you do that surgery, they put something on you like a vice grip, it holds your eye open. They put a rag over the paper thing, the operating paper, over your face. All they see is this little cutout.
Keep it sterile.
They do their work. And the nurse.
It's called keeping it sterile. That's why they had that field around you, Tim. He's like, because Tim didn't do anything for his health until he was this age of an adult. So everything is like unique to Tim.
First kept just dropping these drops in there like lubrication. But anyway, yeah, stitches, and he was doing it forever. And I kept seeing this ultra beam light go across my eye. I guess he just, was looking at each stitch. Hope he did a good job. He's a good seamstress. But I am concerned about it because it really hurt. I mean, yesterday I hate to cry about it, but man, I was miserable. I said, I don't know how I'm going to sleep tonight. So I did take some sleep aid last night that did help me. And but like right now, if I keep my eyes closed, I'm an individual.
I guess he's out of the cough syrup.
Because I can't take it anymore.
If you know, you know.
If I just keep my eyes closed and keep my eyes steady, I'm a little more comfortable. Okay. But when my eye is open, the right eye, and I have to look, and I'm just kind of looking about, okay. The other eye is moving.
Stay still.
And it's scratching that, and the pressure builds, and it feels scratchy, and it's irritating. Yeah. So I got a lot of questions for that man this morning, and I'm a little bit annoyed. I'm not going to go off on him, but I'm going to say, why didn't you warn me that I'm going to be in a lot of pain? I mean, I was concerned about having to go to the dang emergency last night. That's how bad it was, folks. I was just sitting here moaning, holding my eye, didn't know what to do, rubbing my head. Oh, so anyway.
This is what we call in the world of YouTube, social media, Tim is sad fishing. This is sad fishing for sympathy. And sympathy usually means donations to some type of fund.
Okay, that's it. I wanted to check in with you guys and let you see the patch before I go to the doctor this morning. I'll have some more coffee here. Sorry I didn't get showered and wash the sleep off. Sorry you got to look at me like this. But if the doctor wants to do a tube shunt on your eye, now you know that it can definitely crush you.
Yeah. Yeah, we're not going to do any of that crushing, Tim. No, we're not going to do that. But what we are going to do is look at the post-operative instructions real fast, and then we'll finish this up because this has already gotten too long. I sped them up to 1.5, but I had a lot to say. Obviously, I'm in the healthcare field. Okay. So this article, here you can find it, the basics of good post-operative care after glaucoma surgery. This was from Community Eye Health. It's 2016. I probably potentially could have found something more recent, but that's, it's within the last 10 years. 5 is the standard for evidence-based practice, but I would assume that a lot of the surgical procedure for this has not changed, nor have the actual instructions of post-operative care. And from what Tim was saying, yeah, I think this is hitting pretty close. Okay. So, a lot of it can be, obviously having this intraocular pressure removed. Okay. So, the most common glaucoma surgery is known as a trabeculectomy. I believe that's how it's pronounced, something close to that. And then obviously it entails creating an additional passage for the drainage of the fluid inside the eye, and the fluid drains from the anterior chamber. Okay, so basically you're going to put something in that's going to help this fluid be able to drain itself in order to take care of the pressure of the eye. This is what's kind of been going on with it. So a lot of times it can be immediate post-operative care. So that's up to 6 weeks, which is going to kill Tim to have that much time, or longer post-operative care. And that's after 6 weeks. And Tim is kind of really, I guess, at that point. Okay, so obviously I spoke a little bit about what it was supposed to do. Now, obviously, they're going to pad the eye, which is what we saw from Tim. Now, they asked them to ensure hygiene, prevent infection. Patients should keep the face clean, avoid touching the eye. Well, Tim touched over that because he has the patch, I guess. I guess he doesn't feel like he's not touching the eye. But he was touching around that area so much that he loosened the gauze and the bandage. So it was no longer sticking there. So the doctor's going to know he's been messing around in that area pretty clearly because that tape is usually pretty strong. So that's a sign that he's been up to a little bit. Okay. It does say patients may bathe and shower, taking extra care not to bend forward or to touch the operated eye. We saw Tim touching around that eye countless times in that video, and he was bending forward. I think he just thinks that means touching the toes. No, all that bending you would do, all of that, Tim. And then you may put an eye shield. He needs some type of shield. Hands should be washed, okay, before the eye drops. And then there's the post-operative antibiotic. These are the annoying drops that he's talking about. Eye drops, and they have to be every 4 to 6 hours or 4 to 6 times a day. And they're going to be for 2 to 3 months that he's going to have to be really very judicious in his care in order to get good results. Okay. Sorry. I just know he seems already frustrated. It's not even a day in. So they want you to reduce the inflammation because you're going to get inflammation, you're going to get redness, you're going to get swelling. So you've got to use those anti-inflammatory eye drops as well. So there's a dexamethasone, and there's going to be this chloramphenicol, something. I love medical names. Anyway, that's the antibiotics. So you got 2 right there. And those are going to be very frequent for the first few days, and then you're going to go down to 4 to 6. Okay. So and this is 2 to 3 months. So this is really a very intense therapy of eye drops. So, and with all this going on in the eye and all that being dropped in, the last thing he needs to be doing is driving around all the time, worrying about making videos or content. You really need to just be relaxing and taking it easy for a while. Control the pain. And it says it's usual to have some pain after glaucoma surgery, but it's often mild, but nothing's mild because Tim's unique and responds to analgesics such as non-steroidal or anti-inflammatory drugs and acetaminophen. If you go in there asking for a pain medication, Tim, you're going to alert that provider. Just giving you heads up. Now they're telling you all sorts of different complications that can come up within the first 6 weeks. And these are not great. You can get this hyphamia, which indicates the presence of blood in the anterior chamber. And it's going to end up, there's some meshwork in there, and it could end up clogging that thing. You're going to get this choroidal detachment. That sounds terrible. You're going to have to wear special care and protection from injury. I saw he wore his glasses out in the cold. I saw these different soft eye, redness, pain. And there's a lot. And then the principles of longer term post-operative care. You're supposed to optimize your vision, continue to protect the eye, continue medication. I hope he did that. Be alert for signs of post-operative complications, pain, failed bleb or overfiltration. I think he said he had a different type of procedure before, though. So this is for this one then. I don't know for the other one what he had, but any associated redness, discomfort, cloudiness, changes, loss of vision, and again, just cleanliness and hygiene, which we have had questions about Tim's hand hygiene before. So anyway, that was much longer than I thought it was going to be, guys. So I apologize. I will put it into chapters, and I'm just going to say, if you did like this type of content, make sure to hit the subscribes, help me get up the algorithm. And like I said, I'll put this chapter so it's not so long. All right, guys, thanks for watching. I appreciate all the support. If you want to join the community, we are offering memberships. Thank you. Bye.